Good day, ladies and gentlemen. Welcome to the Virtual Care Equipping Your Employees with the Right Mental Health Tools webinar. I would like to introduce Marianne St. Maurice. Please go ahead.
Thank you, Carl, and thank you all for joining us for today's webinar. My name is Marianne St. Maurice. I am the Director of Marketing for Akira by TELUS Health. Our expert today is Dylan Zambrano, who is a registered social worker based in Toronto. Dylan is one of the therapists on Akira by TELUS Health, and he is also a corporate wellness trainer who has presented to thousands of professionals from multiple industries, including education, healthcare, finance, and corporate leadership. Dylan specializes in providing psychotherapy and workshops that are aimed at enhancing resilience and well-being so that people can thrive and perform optimally in their personal and professional lives. Today, Dylan will be speaking to us about how COVID-19 has affected employees' mental health, the long-term impact on their mental health, how virtual care can help provide the mental health support your employees need, and also what you can do to support your employees and their families. We'll be taking questions at the end of the presentation, both using the chat function on your screen and by calling in. Carl will be providing more instructions when we get there at the end of the presentation. I also wanted to mention that we will be sending a recording of the webinar along with the slides later this week, so you'll have that as a reference in a few days. And with that, I will hand it over to Dylan. Thanks, Dylan.
Thank you, Marianne. So I'd like to begin by discussing about how essential mental health is right now. The mental health of employees is important now more than ever. During this pandemic, Canadians' mental health has been significantly impacted for many reasons, which we'll be discussing today. And globally, there have been rising reports of anxiety, of depression, of psychological distress. And one of the most recent studies, which was done by Statistics Canada, they had been monitoring people's mental health throughout the pandemic and had surveyed 46,000 Canadians from April to May through an online questionnaire, and the results are actually quite astonishing. First of all, nearly 1/4 of the participants reported fair or poor mental health, which is actually a significant increase in comparison to data from 2018. In fact, in comparison to the same 2018 data, fewer people are reporting very good or excellent mental health. Additionally, more than half of respondents reported their mental health has worsened since the onset of physical distancing, indicating that their health was somewhat or much worse than it had been previously. And most participants, so about 88% to be exact, experienced at least one symptom of anxiety in the 2 weeks prior to completing this survey. So this included symptoms such as feeling nervous, anxious, or on edge, becoming easily annoyed or irritable, and having trouble relaxing. Additionally, they also found that 41% of people also reported symptoms that indicated moderate to severe anxiety and high levels of stress. Many of the employees that we've worked with through mental health sessions and through conference calls have had children, teenagers, or even parents whose mental health have also been impacted by the pandemic. Youth, too, are experiencing significant concerns about things like academic disruptions, employment prospects, finances, while seniors, on the other hand, might be experiencing things like financial insecurity, health risks, and disruptions to their routines. So Statistics Canada had also surveyed seniors and youth, and what they found was that 35% of the seniors surveyed had experienced negative impacts on their mental health. 64% of the youth had experienced negative impacts on their mental health. And 41% of those youth also reported symptoms that indicated, again, moderate to severe levels of anxiety. So I know, even though youth and seniors are likely not a large portion of those who are employed by you, that their health has an impact on your employees' health. Many people we've seen through Akira by TELUS Health have not only been impacted by their own mental health, but are also significantly worried about the health of their loved ones. We've supported many employees whose anxiety and stress has been exacerbated by their worries of of the risks and the health impacts of the COVID-19 virus and their impacts on their children, as well as elderly parents and grandparents. There was another recent survey that was completed by Nanos Research, and this was done in collaboration with the Mental Health Commission of Canada. They had used telephone and online surveys with over 1,000 Canadians in April. And so, consistent with the Stats Canada research that we were just speaking about here, that they actually found an increasing amount of Canadians are experiencing stress associated with the pandemic. So they had asked Canadians what their greatest concerns have been during this pandemic. And this included things such as financial hardship, impacts on unemployment and the larger economy, the spread of COVID-19, mental health concerns for oneself and for others, changes to our social interactions as we've been instructed to physically distance ourselves from others, the conditions and the capacity in long-term care facilities, as well as across the greater healthcare system, and the loss of life. And so, as you can see here, that there's quite the range of concerns that people are struggling with right now. And I think most of us can probably agree that in one way or another, COVID-19 has either directly or indirectly impacted us, and that at some point each of us has probably shared some of these concerns. Each of us will have dealt with these concerns very differently. Some may have experienced a manageable amount of stress, while others may have endured an overwhelming amount of stress that perhaps significantly affected or is affecting their mental or physical well-being. So regarding stress, the same study discovered that since the onset of COVID-19, that stress rates have actually doubled. They also asked participants about their top reasons for the increasing amount of stress being experienced right now. And it was indicated that people have been stressed out by contracting COVID-19, financial strain and job security, uncertainty and fear, and the fear of unknown, the loss of freedom and feeling trapped, work-related stressors, following precautionary guidelines and witnessing other people not following those guidelines, and the experience of loneliness. At TELUS Health throughout April and May, we actually hosted multiple presentations with one of Canada's largest banks, delivering conference calls to thousands of employees on optimizing mental health and resilience during this pandemic, as well as actually for their employees out east to address the mental health impacts of the recent Nova Scotia shooting. And so we structured these conference calls by acquiring employees' questions in advance, and actually in surveying thousands of their employees about their inquiries regarding the pandemic, I can actually confirm that all of their questions were in fact aligned with all of these topics. Many people were in search of strategies for coping with each of these top concerns. So while our circumstances are constantly changing and are slowly seeming better, it's being predicted that the mental health impacts will be here to stay. Some epidemiologists are predicting that there will be these long-term impacts on the number and the severity of mental health problems due to this pandemic. And if you really think about it, people have never been put under so much stress, so much uncertainty, constant rapid change, risks to our and other people's health, and isolation coinciding all at the same time. Humanity is never prepared to undergo such overwhelming amount of stress. And it's being suggested that there are a series of aftershocks to be experienced beyond the initial wave of this pandemic that we're experiencing right now. And so the first wave we're in now is the immediate surge in morbidity and mortality rates. The second wave is predicted to impact those who can't seek medical care due to closures of healthcare services, deferrals of healthcare appointments for people who are experiencing some non-urgent matters. This, for example, would include perhaps those who, were supposed to have scheduled surgeries, though couldn't due to closures to operating rooms. And the third wave is said to be an extension of this, whereby those with chronic health conditions aren't provided with care when they immediately need it, especially with our existing problem in wait times prior to this pandemic. This poses another challenge once services do open, because as they do begin to open, there's going to be a surge in scheduling appointments that had been disrupted and had been deferred. And so lastly, it's being suggested that the final wave of health impacts from this pandemic are actually going to be mental health related. And, it's arguably what we're already experiencing, right? And this is the mental health impacts that are associated with the constant change, the disruptions, the uncertainty, and the worry that people are dealing with right now. In fact, this is the very reason why our federal government is planning to fund $240 million worth of improvements into our healthcare, mental health care system. And so, as I'm sure many of you have probably experienced, a great deal of our workforce quickly moved to remote work at the start of this pandemic. Companies that, never imagined having a remote workforce were able to move employees home within the span of days. And it's been found that many employees are actually having a preference for working at home, and that employers are actually urgently looking to provide more options for this remote work. It's beginning to look, much like, that remote work will be a new normal for many. And with many people who will likely remain working from home in the long term, we're likely going to see growing popularity in virtual care. And what we know is that a vast amount of employees have a favorable perception of their employers who provide them with virtual healthcare options. And so we'll switch gears here and discuss a bit about what you can do as employers to support your employees' well-being. So here are some of the top concerns that we've addressed to thousands of people in mental health sessions and conference calls, and strategies that you can suggest to your employees during that are dealing with these concerns. So to help your employees cope with increasing anxiety and stress, the first step is to normalize their response and to really just empathize with them. With how rapidly things have changed, most of us will or would have experienced some anxiety or stress or other emotions. Everyone is going to respond differently. And there's really no right or wrong way to be responding or reacting during this time. Accepting where your employees are at in their coping will help to provide them with some relief. Anxiety and stress can both come from feelings of uncertainty and the experience of worry about the future. And so with how much ongoing change we've experienced, many people are worried about, what's going to come next. You can help to address employees' worries and uncertainty by keeping them well informed about perhaps what to do if they or a family member are sick with the virus, how they can take time off of work, what they can expect regarding changes to working conditions, to hours worked, to necessary travel, and what your company is doing to protect their safety and to reduce their risk. and remind them that this isn't business as usual, that you'll work collaboratively to navigate these stressful and difficult times, and that things will eventually return to a normal at some point. And so our next set of strategies here, our first is about promoting connection. So remind people to stay connected, especially in a time of physical distancing. Isolation and a lack of connection with others can actually impact both our mental and physical well-being. And so encourage your employees to maintain connection while taking appropriate safety measures. Especially if your teams are working at a distance right now, ensure that you're maintaining connection amongst your teams. So you can do this by extending your support, promoting reliance on one another, and allowing for open discussions and interactions, whether this is done over the phone and video, whether this is done on a one-on-one basis or in a group setting. You might also encourage your employees to practice regular self-care. So self-care is care that is provided by you and for you. And so it's about engaging in activities that increase our physical, mental, and emotional well-being. These are activities that are meaningful and fulfilling, that have you feeling nourished and really just feeling at your best. And so encourage your employees to consider what their self-care activities are, and suggest that they begin to integrate this into their routines. And I really want to emphasize that this is being done both outside of work, but also within one's work routine. So this might be things like, finding a break for exercise, doing a quick yoga routine, maybe a quick meditation. For some, it might be engaging in favorite hobbies, or finding new activities to participate in as we sort of adapt to the current circumstances. This regular self-care, when it's done frequently, really helps us to build a resilience to stress. And so many people have experienced immense loss during this pandemic. And so this might not only be loss of life of loved ones, of close ones, but losses of routines and structure. For some, it might be jobs or financial security. For others, it might be important events like weddings or graduations that were supposed to occur. You can support your employees in their grieving process by empathizing and validating their response, creating space for their feelings and acknowledging the pain it's caused them. People cope best with grief when they have the opportunity to process and express their thoughts and feelings. And so either you can offer to listen and to provide them with this support, or direct them to someone that they're comfortable talking to, whether this is another colleague, a friend, or a family member that can support them in their grieving process, to really support them as they adjust to these losses. And as mentioned earlier, the mental and physical health of our loved ones is just as important as our own. So if our loved ones are suffering, this takes a toll on our own well-being and our own suffering as well. And so give your employees the space and opportunity to address the health of their loved ones, whether this means having permission to take breaks to attend to childcare demands, or having some flexibility in hours to support their families. And so when choosing to have your employees return to work, first and foremost, follow your local provincial safety guidelines and recommendations. And in planning their return, it's important to consider such questions as, how can we mitigate the stress and anxiety of our employees? How can we support employees' mental health during their transition back to work? How can we help restore productivity while setting reasonable expectations? And to address and optimize their mental health upon their return, you might consider keeping your employees informed and providing updates on the transition plan, especially well in advance, and consider providing a gradual return to work, perhaps with some flexibility in their hours, and allow people to adjust to any changes or increases in demand, really adjusting slowly as they're returning. Creating an environment of safety and control to alleviate stress and anxiety. So whether this means having screening measures, PPE, or other protections to reduce your employees' risk, and ensuring that the workplace has all necessary equipment to begin performing their job once again. Being aware of signs of worsening mental health, such as poor concentration or work performance, increased worry or distraction as they're trying to perform their jobs, low moods, changes in behavior, irritability, or absenteeism, which is basically when people are absent from work. You might also consider some paid mental health leaves and time off, perhaps a certain allotment of days for employees to address their mental health. Maintaining an open dialogue about people's mental health, checking in on a one-on-one basis, or creating opportunities for those discussions to happen amongst your team meetings. And have mental health resources and quality mental health support ready to provide to your employees. Because ultimately, when your employees are healthier and happier, they can perform and actually do more. And so the economic burden of mental illness in Canada is estimated to be approximately $51 billion per year. This includes a loss in productivity levels. And in any given week, at least 500,000 employed Canadians are unable to work due to mental health problems, whether this is from disability cases or from people taking sick days. And it's suggested that the cost of a disability leave for a mental illness is about double the cost of a leave due to a physical illness. Mental health problems haven't risen only because of the pandemic. Prior to this pandemic, in fact, the rate of mental illness in Canada was 1 in 5 people. It's actually said that by age 40, about 50% of the population will have or would have had a mental illness at some point. And mental illness doesn't discriminate. It affects people of all ages, education levels, income levels, or cultures. And so really, pandemic or no pandemic, mental health problems are here to stay. And if they're not handled effectively, they can have significant impacts on your employees, but also the larger company. Many Canadians now actually view mental health care as just as important as medical health care. And this suggests that the stigma has reduced over time and that people see the value in and are willing to address their mental health. And so, not surprisingly, on the Akira by TELUS Health app, we have seen significant increases in mental health appointments. The top concerns that we've seen have been anxiety, depression, and insomnia, which coincides with these global reports of rising rates of anxiety and depression throughout this pandemic. And by seeing patients virtually through the app, we've been able to actually resolve 95% of their presenting issues, whether this has been through counseling or therapy, medication, or referrals to specialists. At Akira by TELUS Health, we have a growing team of clinicians and registered specialists who are always available, making it really simple for employees to get the support that they need. And so our mental health therapists specialize in helping people with a range of presenting concerns. And these are issues that pertain to things like anxiety, depression, or grief, to things like work, life, or relationship stressors or difficulties. We have a team of specialists that can treat, diagnose, prescribe medications, and to refer to specialists when needed. And ultimately, our team is committed to creating a more engaged workforce of happier and healthier employees. And so I'm now going to pass it back to Marianne, who will actually speak a little bit more about the Akira by TELUS Health.
Thanks, Dylan. Thank you for all that information. And as mentioned before we take any questions later, which you can do through the chat or on the phone with Carl, our moderator, so before we get to that, I want to expand a bit more on how Akira specifically can help provide mental health support for your employees, but not only your employees, also their family members. So just for context, all Akira accounts actually extend to a member's partner and children under 26, and there's no limit to the number of children that they have. So all of Akira's clinicians can provide mental health support, and that's 24/7 on demand, which means that they can help address people's needs as soon as they need help. The fact that consults are done by text and video also helps to reduce the barrier to entry for patients, especially those who may never have asked for mental health support before. And so it lowers the barrier to entry to that difficult conversation that they haven't had before. Our clinicians can also assess and diagnose mental health conditions. They can create and help manage health plans, and they can provide referrals to registered mental health therapists, either externally or on the Akira app directly with some of our therapists like Dylan. We also have a psychiatrist on our team, Dr. Jose Silveira, who I will tell you more about shortly on the next slide. And what's really important to note here is that by being available 24/7 and every day of the year, our clinicians can help patients as soon as they need it, which, especially in mental health cases, is very important. So we'll now go a bit more detail on Akira's psychiatry program, which is something that we started about a year ago and has been hugely successful, with a lot of our members and clients. So as some of you might know, wait times for a psychiatry assessment can take months and sometimes actually up to a year, depending on where in the country you're located. So we've built a program to address those wait times. By having Dr. Silveira, a renowned psychiatrist, on our team, we can help bridge that gap. The way we do that is very simple. So patients will engage with our clinicians, like I said, 24/7 by text or video, and they can help with them with the mental health support they need. So whether it's from counseling to prescriptions. That said, there are obviously cases that will require more expertise, and that's when our clinicians can work with Dr. Silveira to get his insights and his advice. So the clinicians can turn around and then help out that patient with more in-depth support that will help tide them over until they can have that assessment with a psychiatrist. So this program has been proven to be extremely valuable because our patients get the support they need right away, and our clinicians also are learning with every consult they do, and so they can then continue to provide more advanced mental health support to patients as soon as they log on. So this all fits in with our broader approach to mental health support. We offer comprehensive care, so both mental and physical, which can often be related, and our clinicians follow up with patients who need it. Lastly, our specialists are also available for appointments directly on the app. So in a nutshell, this is our mental health vision at TELUS Health, and more specifically at Akira by TELUS Health. We want to deliver the best mental health services that we can, which also means accessible services. We want to empower those who need mental health support and their families, and we want both those things to help you and your employees create positive, healthy, and productive corporate cultures where employees feel supported and valued. So to wrap this all up before we take questions, I wanted to provide you with an overview of what TELUS is doing in health. So at TELUS, we believe that technology can have a huge impact on transforming healthcare by connecting health practitioners with one another and with their patients. And if there's ever a situation where we saw that really happen, it was during the last few months of COVID, where having access to virtual solutions really helped both patients and practitioners stay safe while getting the health and the support that they needed. We're also working to make prevention and wellness more accessible for everyone. Since 2008, we've developed a wide array of digital solutions for all major stakeholders in the healthcare system. So that's hospitals, physicians, pharmacists, specialists, and more. Our solutions aim to improve the patient experience, increase efficiencies, and positively impact health outcomes. Well, thank you all for joining today's session. I hope it was valuable and that you learned some good takeaways. Thank you all.